Thank you so much, everyone. Thank you for joining. My name is Laura Santner, and I'm one of the therapists here at Trickstop. And I'm here today to answer your questions. So this is a really great opportunity, and it's going to be pretty casual. So I'm going to go over the most commonly asked questions first, and then the pre-submitted questions, and then your live questions. Okay, so sit back, relax. It's pumpkin season, so have maybe a pumpkin latte or a pumpkin pie. I have a little pumpkin fidget here. It's a little popper fidget. And I also discovered these little you can't really tell because it's been used, but it's a little pumpkin slinky. So it's actually pretty satisfying is to take your finger and these mini slinkies and just kind of roll your finger around. Um, and it's strangely soothing and satisfying. So I wanted to share that with you before we get started. You just can kind of go all the way through. Um, so grab a fidget and let us get started. Okay. So what causes hair pulling? So a hair pulling disorder is rather complex, and still more research is always needed. But basically, right now, research is indicating that there is an inherited predisposition. So that's a big part of it. However, that doesn't mean that's the entire part. So just because it's within your genetics does not mean you're going to wind up with a hair pulling disorder. So it's a combination of factors. So yes, those genetic components, but also combined with hormones, temperament, and age of onset, any potential co-occurring disorders play a role, and environmental stress factors. Okay, so it's really right now, it is shown that it's caused by a variety of factors. So it's not just one, there is no just one cause. Okay. Um, Let me see. And just a reminder, please write your questions in the Q&A section and we'll get to that after we do the pre-submitted and the commonly asked questions. What kind of therapist do I look for? So the best kind of therapist is one that's trained, right? That's trained to work with BFRBs. So you can find trained therapists on trickstop.com. As of now, you can find trained therapists on bfrb.org. FYI, bfrb.org is going to be transitioning to the International OCD Foundation, even though Trick is not OCD, but it is that is going to be the new kind of umbrella organization. So there will be providers listed on that website. Okay. When you are looking for providers, you want someone that's knowledgeable in certain modalities. So you want to look for something that's called COMB, okay, or the Comprehensive Behavioral Model. ACT, Acceptance and Commitment Therapy, Habit Reversal, HRT, and regular cognitive behavioral therapy, CBT, dialectical behavioral therapy, DBT. So it's it's that combination of things. Okay. Um, any of the therapists on TrickStop are all knowledgeable, by the way. So you can trust any of us in this program. Excuse me. And the most important thing, besides being trained, is just your comfort level. So see who you connect with, because that winds up playing a really large factor. So you want to make sure you're comfortable and that you connect with your therapist. Is this a lifelong struggle or is it possible to stop? Yeah, so BFRBs, trichotillomania is a BFRB, body focused repetitive behavior. So it is a chronic disorder. So what that means is that unfortunately there is no cure. So yes, it is lifelong. However, that does not mean that it is active your entire life, and it does not mean that it's going to impact you your entire life. Those urges can go dormant, they can decrease, they can go away, but it's a part of you. Okay. So, the more that you learn strategies, the more that you practice, the more prepared you will be for when those urges do arise, and you'll be able to better manage them. So, um, unfortunately, it is chronic, it is lifelong, but it does not mean it is going to impact you and be active your entire life. Okay. And by the way, if you have any follow-up questions to any of the common questions or the pre-submitted questions, again, feel free to write in the Q&A box. What is NAC? Is it helpful? And is there a recommended brand and a recommended dose? Okay, so NAC, it stands for N-acetylcysteine. And right now, that is the most promising medication. And I say medication because it's not actually a medication. It is an amino acid supplement, so it's over the counter. And a lot of people say that it's helpful. It kind of brings this sense of relief. It kind of releases some of that tension that you might feel in your body. The brand that cooperated with research was the brand Swanson. So some people feel most comfortable using the brand that was most cooperative, Swanson. I'm also familiar with the brand Now, and I've heard good things about that brand as well. So see what brand works for you and what you're comfortable with. Um, the recommended dose is to start off with 1,200 milligrams. So, and they recommend to break it up. So it comes in 600 milligram tablets. So like 600, let's say in the morning, and 600 in the evening or something like that. You can take, studies have researched up to 2,400 milligrams. There are reasons to believe that even going up to 3,200 milligrams would be beneficial, but they've only studied up to 2,400 milligrams as far as I know. So I do recommend dividing the dose up though throughout the day, because um, the amino acid supplement is somewhat short lasting. So it stays in the system like 8 to 10 hours. So that's why it's helpful to take like a morning dose and an evening dose, or take it right before a time when you tend to have higher urges. Some people feel that it only stays in their system like 3 to 5 hours. So take it right around the time that you are anticipating more of a need. Okay. Hope that was helpful. So how does NAC work? So again, N-acetylcysteine. So it is an amino acid supplement. So it works for hair pulling by modulating the glutamate levels. It's all about glutamate. Okay, a lot of research now is they're even studying other medications, but around this glutamate, around glutamate levels. So those glutamate levels in the brain, it helps to provide antioxidant properties. So basically, by regulating those neurochemical pathways, NAC can help to reduce pulling. So it basically restores kind of the brain's glutamate balance, which helps to curb those intensity of the urges and help to control um, those impulses. Okay, so it's about um, balancing your glutamate levels. Other medications that are showing promise right now, by the way, is memantine, which also kind of looks at this glutamate factor, but more research needs to be done. Okay, so as of now, NAC is the top choice. Memantine is looking pretty promising. And other medications that look at these glutamate levels are also starting to look promising. So we'll see. We'll see. Let's see. Are there common triggers I can avoid, and what can I do to manage these urges? So, um, I always recommend doing some tracking first and self-monitoring so you can learn more about your triggers, and figure out what's happening for you. Triggers typically, common triggers are typically related to when you're overstimulated or understimulated. So, for example, like stress, anxiety is an example of being overstimulated, and being bored is an example of being understimulated. So those are some common triggers. In addition to that, triggers can kind of range from sensory triggers, like what your hair looks like and feels like. Cognitive triggers, what are your thoughts? Affective triggers, what are you feeling? Motor triggers, so like your body position. And place, so where are you located, like bathroom or in front of the mirrors, bed, right? So when you start to notice patterns within that, and you learn about your different situations, then you could think about what strategies you want to try to implement. So, for example, like sensory strategies would be like different kinds of fidgets, right? So, different kinds of fidgets is a sensory strategy. Cognitive strategies are things about being mindful about what you're telling yourself, and how you are phrasing and rephrasing those thoughts. Okay. Effective strategies are including how you express your feelings. So that could be like breathing, relaxation exercises, regular outdoor exercise, writing, art, music, right? Those are all ways to help with your expression. Okay. Motor strategies. So motor strategies can be things that you can block yourself. So when you're in certain positions, you're going to block yourself. They're barriers, right? So gloves, tapes, band-aids, hats, scarves. Okay. And place strategies can include, it's about being mindful of your environment and making changes to your environment that you're in. So, for example, instead of like working at home, work at like a coffee shop, right? You're going to change your environment. Instead of sitting in your favorite spot on the couch, sit on the floor or a different spot on the couch. Okay. If you're in the bathroom, maybe you want to cover a mirror or dim the lights, right? So you're altering the environment. Okay. So I'm just naming a couple of ideas. There are endless ideas, lots and lots of potential strategies. So these are just a couple to kind of get you started. Just a couple of suggestions. Okay. Um, okay, let's see. Do you have any book recommendations that would help? Mm-hmm. So I have a very long list of books that I've been slowly collecting, but I just wrote down a couple to share with you. Some of the kind of main goodies, goody ones. So I would say like the number one book is it's called Overcoming Body Focused Repetitive Behaviors. It's a comprehensive behavioral treatment for hair pullers and skin pickers. So that's by Charles Mansueto, Sherry Mansfield, and Ruth Gollum, some top people in the field. Okay. There's also an oldie but a goodie, Help for Hair Pullers, Understanding and Coping with Trichotillomania. So that's by Nancy Cuthan, Dan Stein, and Gary Christensen. Again, some really good people in the field. If you're looking for more of like a workbook style, there's a couple of really good ones out. So Trichotillomania and ACT Enhanced Behavioral Therapy Approach. That's by Douglas Woods and Michael Twohig. There's also the BFRB Recovery Workbook. That's by Marla Deibler and Renee Renardi. Some newer books that are coming out are the BFRB Survival Guide. So that's a workbook for overcoming body-focused repetitive behavior. So that's by Susan Moten Odom, Ruth Gollum, and Charles Mansueto. And then the BFRB workbook for teens and young adults is one to keep an eye out for. That's by Lauren McKinney and Dr. Laura Shacks. Okay. So just a couple, right? I know that was a lot, but just a couple of books to get you started, if that's something that you're interested in. My daughter is 15 years old and pulls her hair, eyelashes, and eyebrows. She has off and on since she was 6 years old. I suggested putting Vaseline on her eyebrows and lashes at night so she won't pull, or braiding her hair or wearing ponytails so it makes it hard to pull. But she isn't interested. What makes her not, what makes her not try harder not to pull her hair out? And why can she sometimes stop with good incentive or a reward she wants, but sometimes can't? So those are really great suggestions and strategies that you're already trying. She can also try, keep doing that. If she's interested, you can't force her. If she's not interested, she's not interested. Okay. So some other potential things that she can try could be like thin cotton gloves. So like put moisturizer on hands at night and then put the gloves on, or a silk cap, or soft blanket. You can also check to see if she's comfortable at night. So just be mindful of the bedtime routine and her comfort level. So you might need to change up the timing and the order of your routine to see what works best for her. But it's important to keep a relaxing environment at night. So think about a routine that's going to help encourage that wind down, that relaxation. So soft music, some stretching, some breathing exercises you can do together. She can do on her own. So try some other strategies besides just the sensory stuff, and see if she likes it. But again, if she's not interested, you can't force her. Okay, she has to want to try different things. Um, it's not about her trying hard. I think that's important to keep in mind. She is trying hard. She is trying plenty hard. This disorder kind of has a mind of its own. So sometimes some urges are stronger than others. So she may have an easier time managing in one situation or one night and a harder time in another. Overall, the better that she feels about herself, like the less shame, the less embarrassment, the easier it will be for her to practice those strategies. The reward system is a really great strategy, but do not reward pulling or not pulling. Okay. It's only a helpful strategy if you're rewarding using strategies. So basically, keeping a chart, doing check marks or stars every time she is able to use a strategy, regardless if she's pulling or not pulling. Okay. It's really focusing on strategies. Um, yeah, I think it's just important to remember that there's going to be good days and not such good days, and that's okay. And don't feel discouraged. And keep trying. Some days she might feel more motivated than others. Motivation, I like to use the word actually energy levels oftentimes instead of motivation. If she's really tired, it's going to be harder to manage urges, for example. So kind of check those energy levels. Okay, but she's trying hard. I've had trichotillomania my entire life. I only recently made it impossible. I cut my hair into a cute short style and I am unable to twirl or pull my hair. And I was never an extreme eyelash or eyebrow thing like that. I just have a weaker left side. I'm going to keep my hair short from now on, and I believe that will be the end of it. Oh, well, I hope so. That would be exciting. I mean, I'm glad that you found a strategy that worked for you. And it helps you to feel more comfortable and confident. And that's so important, to feel comfortable and confident. So for some, yes, cutting your hair, keeping it short, shaving your head, changing up hairstyles, can really help you to feel refreshed, especially if you're going routinely to a hair salon that you feel comfortable with, because there's something about that that helps with accountability and then just helps to like pamper yourself and have someone else do it. So it can make a really big difference. So I hope it continues to work for you. Thank you for sharing. Let's see. Is it helpful or appropriate for someone 9 years old with trick to use a fidget that replicates the pulling motion? So for example, feathers out of a pillow, yarn out of a blanket, or a pulling fidget from Amazon. I have been given mixed messages on whether it is harmful or helpful. So, good question. I would use fidgets that your 9-year-old likes and enjoys and is excited about and is interested in. So, if those fidgets are something that appeals to your 9-year-old, then it's fine. Do it. It's close to the things that you're describing are close to the sensation and the movement, but it's still not the same. And it's still not going to feel the same. The arms are going to be, depending on where she's pulling, it's not going to be in the exact position. It might be close, but it's not the same. Uh, when you're doing strategies like that, you're only getting that stimulation like from your hands, your fingers, the movement. You're not getting the stimulation on the body part, the area that you're pulling from. So you're only getting stimulation in part. Um, so it's not going to be harmful. I don't see how it would be harmful, but it has the potential of being helpful. So I think the most important thing when it comes to strategies is what strategies is going to excite you or excite the 9-year-old, and what's going to be exciting to use and interesting. And with any fidgets, they also might be interesting and exciting for a short period of time. So it's good to have a variety of options to kind of keep switching it up, and that helps it to keep it more interesting. Okay. That concludes the pre-submitted questions and the most commonly asked questions. So I'm going to go to your live questions. Let me open this up. Okay, lots of windows open. Oh yeah, so this is a really good and actually a common question I should add. So is it common to do both hair pulling and skin picking? Yes. Yes, very common. um, the short answer is yes. The little bit of a longer answer is that, BFRBs tend to travel, or they have the potential of traveling. So it's really common if you're trying to manage one area of pulling, for example, it might pop up in another form, such as skin picking. But overall, yes, it is very common to have multiple BFRBs at the same time. So hair pulling, skin picking, nail biting, lip biting, tongue chewing, for example. Yeah. Can a teenager take that supplement? So NAC, yeah. So NAC, the amino acid supplement, it has pretty low to no side effects. So anyone can take it. It's just a natural amino acid supplement. There really is not no risk as far as I know, and from the research so far. So yeah, a teenager can take it. If you are feeling nervous about it, I would still talk to a psychiatrist or medical doctor or pharmacist. And you can always start even lower at 600 milligrams instead of 1200 milligrams, and see what happens. Ah, can caffeine cause an increase to pull? Yes. Large amounts of caffeine, yes, but moderate amounts of caffeine actually have shown to help with pulling. Let me just pull something up quickly. So there has been research done on this by Dr. Grant, who does a lot of research. So yeah, so basically moderate daily caffeine use can be and is associated with lower BFRB severity. So that's pretty interesting. High levels of caffeine, yes, can kind of make you jittery, make you more antsy, and can increase urges and lead to more impulsiveness. But the amount Moderate meaning like 1 to 3 cups per day. Let me see. It's approximately 150 to 300 milligrams of caffeine per day. So that can help to actually increase alertness in individuals with BFRBs without bringing those negative effects of the higher doses. So if you're interested in learning a little bit more about that, just look up Dr. Grant and BFRB caffeine, and you'll find his study. And it's pretty interesting. Is there something underlying why this starts that needs investigating? Perhaps bullying, aren't we doing it as unable to cope initially and later it becomes a comforting habit? No, not necessarily. So again, it can kind of start, like I mentioned before, if you have a genetic predisposition, and that in combination with other things. So, pulling is a way to regain balance. So yes, emotion regulation comes into play a lot here, but not everyone that pulls has been bullied. So it doesn't necessarily start from something stressful. Um, and it's not necessarily used as a way to cope with a stressful situation. There's a lot of stressors in life, unfortunately. And every time a stressor comes up, that doesn't mean someone's going to start pulling. So it's really that combination of factors. If you have that predisposition and the stressful factor comes up, yes, it will increase your chances of it developing into a BFRB, right? But not necessarily. Hope that answers. But you're right that it is pulling is a way of comfort, right? It's a way of self-soothing, but not necessarily just in anxiety provoking situations. Yeah, mine started so innocently by trying to remove baby hairs, yep, from the front of my head 5 years ago. How did it turn into this? I now pull mainly from the back top of my head, and it is especially worse when I have new growth that are short. Yep, leaving me with bald spots. Yeah, so that's a really good example where there was no bullying, nothing kind of traumatic happened. Um, but perhaps there was that genetic predisposition and you're just doing regular self-grooming and it became this BFRB. BFRBs, I kind of describe them as self-grooming behaviors gone awry because everyone engages in self-grooming, but not everyone takes it a step further. And if you have a BFRB, you wind up um, accidentally taking it that step further. And that's just what winds up happening to you. Um, and in this situation, this was a sensory trigger. So again, that combination of things just happened to happen for you. Uh, yeah, and when it's worse, when you have new growth, that's a sensory trigger, right? Yeah, because it feels weird, it looks different, um, and it's tough. It kind of becomes this cycle. Oh, I think I read this one already. Yes. Okay. Yeah, I was recently diagnosed with ADHD and have been on medication for this since June. I've always pulled my hair, but have noticed my hair pulling has now increased. The ADHD prescribers say this is not a common side effect, but I may be more aware of it. Mm, but I can visually see the increase. Are the two related? My ADHD medication is a stimulant, so this answer may be partly covered from the caffeine question. No, that's a really good question. So having ADHD and BFRB are super common, right? Because they're both related to overstimulation and understimulation. So having both is super common, but you are right to trust your instincts because some ADHD medications can increase hair pulling. So if you are noticing that your pulling is increasing on your ADHD medication, it means it is not the right medication for you, um, or the right dose for you. So it is quite a common experience. So, and it's a little bit tough to navigate, unfortunately, because ADHD medications are so helpful, can be so helpful for ADHD, but some of those medications can increase hair pulling. So keep exploring with your doctor about potentially changing that particular medication to a different ADHD medication if you continue to feel and notice that it is increasing your urges. Okay. So it is so when your prescriber said it is not a common side effect, it's not a common side effect per se of the medication, but it is a common experience if you have both ADHD and a hair pulling disorder. Okay, so see if you can change medicines. What is the best way to take care of sensory triggers? Yeah, with sensory strategies. So if your most common triggers are sensory, so like what it looks like, right, what it feels like, even the sound, right, the sound, maybe not so much the taste. Um, but if your triggers are sensory related, then take a look at strategies and fidgets that are sensory related, right? So, I showed you, right, sensory triggers. These are examples of sensory triggers. You just got to kind of try different things. This one's a good one. What I like about this one is it has a little noise too. So some feel good and also make a noise. So it's a little bit of experimenting and see what fidgets work best for you. I did do a whole webinar on fidgets, so that should be on our YouTube channel. So you might want to check that out because I go in depth about a lot of different fidgets and things to try. So that could be of something of interest to you. Okay. Yeah, I like this question. Is it possible for my hair to grow back after pulling my hair on top, back, and left side? I've been pulling since 7 years old. I'm now 47. I've tried shaving my head and it hasn't grown back. Yes. So hair is pretty resilient, and it's pretty remarkable. And so yes, hair grows back. Even if you shave your head, it grows back. If it hasn't grown back yet, I mean, hair grows back at different lengths and different rates. So growth might start in one area, but not in the other, or one might start growing longer than the other. So have patience. If you notice that your head is shiny, um, that would be an indication that it might not grow back. Um, it, it can happen. It can happen that the scalp becomes shiny and then the hair doesn't grow back. But typically it does grow back. Okay. And no matter how long you've been pulling for. Yeah. So give it some time. Again, if it's something that you're concerned about, you can always try, um, some different products to kind of help stimulate some growth and see if that happens. But overall, yes, it should grow back. Other than creams, over the counter, or steroidal, is there something that can be used to suppress, oh yeah, the itching that occurs with hair pulling, which is a trigger? Yeah, itching, you're right, is a big trigger. Um, so it depends on where you're pulling from. So depending on where you're pulling from, kind of depends on what products you can use. So I don't have well, actually I do. I do have a list that I've been slowly collecting. It's not a long list of products that people have recommended to address the itchiness. But it sounds like you've already tried some things. So I don't have any other suggestions of besides, different kinds of creams and over the counter stuff. Um, that would be beneficial. I think that you're doing already. You're doing what you can do. That itch is uncomfortable. Um, and if you're not finding something that's helping with the itch, keep looking. If you want my little list that I have, just email us at support@trickstop.com. And I'd be happy to email that to you and see if anything on that list does help. Um, it's just a small list of some products that people have told me that they found that were helpful. So yeah, you just email us at support@trickstop.com and I will get that short list over to you. Do you know of any kind of link between fluoxetine and increased hair pulling? I do not. Again, if you are taking a medication for something else, and then noticing that it is increasing your hair pulling, it just means that it might not be the right medication for you. Okay, and you kind of have to outweigh, like think about the pros and the cons of a medication. Like if it's helping something else and doing really well with something else, but it's increased your hair pulling, like is that worth it for you? Or would you want to talk to your doctor and try something else? Um, so that's what I would recommend. If you're noticing that it's increasing your hair pulling, talk to your doctor and see if you have other options that may make sense for you. If I don't stop pulling now, 20 years old, will this impact the thickness with aging? Um, Again, most likely not, because hair is super resilient. It's pretty rare that the hair will eventually, the follicles will kind of die and then your scalp will become shiny. It does happen. It does happen, but it's more on the rare side. So in general, it does not affect the thickness with aging. Um, that said, some people have experienced that. So it's hard to say, like, give like a yes or no answer because everyone's kind of hair type is different. So overall, no, it doesn't affect with the thickness. But as it grows back, it does, it might be a different color, it might be a different thickness when it's growing back, but it doesn't mean that it's going to stay that thick. So it might be like thinner when it grows back, for example, but it doesn't mean it's going to stay thin. Sometimes it just takes a little while for it to kind of recuperate and get back to its usual quality. So overall, generally no. Sometimes people experience this, yes. Um, but I would not be too concerned about it at this point. Okay. All right. I went through those questions kind of fast. Excuse me. Are there other questions? Questions, comments, concerns? Anything at all? And if you think of something later that we did not address here, please email us support@trickstop.com, and we can answer your questions later on as well. If you think of a question and you want to ask it live and not email it to us, we have more question and answer sessions. I think our next one is going to be in January. I think January. So keep an eye out for them, but we do them somewhat regularly. So we have lots of opportunities just to kind of chat and ask questions. Okay. All right. Well, I'm not seeing other questions coming in. Oh, okay. We got another one. Ooh, do you have suggestion for best wigs? Oh, that is a huge topic. And actually, that would be a really interesting webinar. Because there are so many types, right? There's so many types of wigs. And it's actually more questions are coming in. There's so many different kinds of wigs. There are different kinds of synthetic wigs. There are different kinds of human hair wigs. So it kind of just depends on you and what your comfort is. And some wigs are hot, some are cool. There's so many. So I think no, I don't have a suggestion for the best wig, because it just depends on how you wear it, your needs, what activities are you doing, what are you comfortable in. um Different wig websites have a lot of information. Actually, I want to say the Wig Emporium. Um, whoever Sharon Salazar. So look up Sharon with a CH, Sharon and a Y, Sharon Salazar. So she owns a wig company, and she has Trick, or she grew up with Trick, and she's very familiar with wigs. And she's got great customer service. So I would actually suggest looking up Sharon Salazar. I think it's the Wig Emporium. Um, and talk to her about kind of what you're looking for and what some of your needs are, and see what she has for suggestions. And I love that question, and I think that would be a really great webinar topic. Or maybe we can even get Sharon to do to do something with us. So it gives me an idea. So thank you. Maybe I'll reach out to her and we'll see if we can get something done. Okay. Are you based in Canada for therapists? So TrickStop is international. So anyone anywhere can join TrickStop and the community and receive treatment. Anywhere, everywhere. Okay. For therapists. So for so if you are a therapist with a BFRB, yes, absolutely. For therapists for training, no, we do not do training at this time. But if you are a therapist without a BFRB, you certainly could still just go through the program and see what it's like and see what information you can get. Absolutely. But as of now, we don't have any specific trainings for therapists. Just a program that's offered worldwide. Yeah, so this program is online. So it's typing based. If you're interested in joining, again, if you have other questions, feel free to ask support@trickstop.com. But it is typing based, so your therapist will respond to you within 24 hours, just because we are worldwide. Everyone is on different time zones. Um, and it is very accessible. So it is a really good option to consider, especially if you don't have therapists that are knowledgeable in your area. Oh, yeah. Webinar on wigs. Yeah, I'm gonna let them know. I think that's a great idea. For yeah, are you based in Canada for therapist for therapy? Someone looking for therapy. We are based everywhere. So yes, so Canada, any we have lots of clients from Canada. Anyone can join our program anywhere around the world. Oh, yeah, this is a good question. I saw my mom pulling her eyelashes out when I was a child. Did that cause me to start? No. No, that did not cause you to start. It could be one of those additional environmental factors that we talked about. But again, that there's that genetic predisposition, right? So your mom was a lash puller. Um, it's in the genes. So that's a big factor in why maybe you started to pull as well. Just because you see a parent pulling doesn't mean that you are going to become a puller. Um, Again, it's that combination of factors. Okay. Anything else? I like those slew of questions right at the end. Okay. Well, if there is nothing else, we will wrap up. But again, I'm so glad you were able to attend today, and I hope that you found this helpful. We do these regularly, so come again. Um, and if anything comes up in between, just email us at support@trickstop.com. Oh, we got a straggler question. All right, we'll do one more. My stepson has just admitted he pulls his hair, but then said he had stopped for now, dismisses my conversation. Is it my fault? No, it is not your fault. It is no, 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 no. Um, it's this, again, this complex disorder that just kind of comes up with a variety of factors and causation. So it is not your fault. There's nothing you did. There's nothing that you are doing that is going to cause your child to have a hair pulling disorder. Okay. Yeah. Okay. Good. Glad you got that last question in there. I'm glad this is helpful. I'm seeing some comments. Thank you, comments. And to do another one, this was so helpful. Yes, we do these pretty regularly. Again, the next one I'm pretty sure will be in January. So just keep an eye out for that. And thank you everyone for joining. Oh, yes, we have a blog. Another last minute. Yes, we have a blog and a YouTube. We have both. So you can look, if you just look up TrickStop, you should be able to find it. You can get on the TrickStop mailing list without joining the program and just get emails whenever there's a new blog. So that, yes, there's lots of blogs and lots of things on our YouTube channel. Okay. Oh, very good. Okay. All right. Well, thank you very much, everyone. Take care, and maybe we'll chat again in January, or through email if you have questions in between. Okay. Thank you so much. Oh, thank you. Thank you. Take care.